Hong Kong has recorded 30 new imported COVID-19 cases, the highest single-day count in more than 2 months. Most are people returning from Pakistan. The previous high on April the 3rd was when the city recorded 43 new local and imported cases. Roland Lim reports.
Hong Kong has no new locally infected cases for the 9th consecutive day, but there has been a spike in the number of imported cases. These are returnees from a chartered flight from Pakistan. According to the Centre for Health Protection, the highest number of infections found were on the same flight on May 30th. 16 out of 83 passengers on flight QR818 from Pakistan. The CHP also says that the infection rate on that flight was 19%, but said that in-flight transmission was unlikely the cause, as there was no evidence to suggest that, and stringent control measures were imposed at the time. The government has also been arranging specially chartered flights from India back to Hong Kong for an estimated some 3,600 residents stuck there since March 24th. Now, this weekend, more than 280 residents, mostly of Indian descent with Hong Kong ID cards, arrived back in the city. The returnees from Pakistan that tested positive at the city's quarantine centres have not come into contact with the general public here. Upon arrival, all returnees are required to provide deep throat saliva samples at the AsiaWorld-Expo. Now, all Hong Kong residents arriving from Pakistan, India, Bangladesh, as well as South Africa must also be quarantined at government facilities for 14 days instead of self-quarantine at home. Now, that's because of the relatively low levels of testing done in these countries. The CHP is worried that those with mild symptoms may have gone undetected. Remember, also on Sunday, there were 3 imported cases that they had a travel history to Brazil, India, as well as Indonesia previously. At this time, all non-residents are still barred from entering Hong Kong, although transit passengers have been allowed since June the 1st.